Hello everyone, myself Bhuvaneshwari of PharmD second year. I am here to explain about auto-brewery syndrome. An auto-brewery syndrome, also known as gut fermentation syndrome. It is a rare medical condition in which ethanol is produced in the digestive system to the fermentation of carbohydrates by yeast or bacteria. This causes a person to become intoxicated without consuming any alcoholic beverages. What are the causes of auto-brewery syndrome? Auto-brewery syndrome is caused by the abnormal fermentation of carbohydrates into ethanol in the gastrointestinal tract. This occurs when certain microorganisms, particularly yeast or bacteria, overgrow and ferment sugars. Yeast overgrowth. The most common cause is an overgrowth of yeast. Candida species, Candida albicans. These organisms can ferment carbohydrates into ethanol in the gut. Antibiotic use. Recent or prolonged use of broad spectrum antibiotics can disrupt normal gut flora. This disruption allows opportunic organisms like yeast to proliferate. Underlying medical conditions that impair gut motility or immune function may contribute to auto-brewery syndrome, such as diabetes, short bowel syndrome, liver dysfunction. Immune system suppression. A weakened immune system due to illness or medications can fail to control microbial overgrowth. Case study of auto-brewery syndrome. In the first case, a boy in the year 1948 experienced a stomach smell of alcohol, and in the second case, in the year 1952, when a Japanese scientist reported a patient exhibiting signs of alcohol intoxication without consuming any alcohol. This patient had a significant overgrowth of Brewery's yeast in the gastrointestinal tract, which led to the fermentation of indigested carbohydrates into the ethanol. The patient experienced episodes of unexplained drunkenness after meals rich in carbohydrates. Subsequent investigations revealed endogenous ethanol production due to yeast fermentation in the gut. Pathophysiology of auto-brewery syndrome. An auto-brewery syndrome occurs in the gastrointestinal tract, particularly the small intestine, becomes a site of endogenous ethanol production due to fermentation of carbohydrates by overgrown microorganisms. Gut dysbiosis. Normal gut flora includes a balanced population of bacteria and fungi. Fermentation of carbohydrates. In the presence of excess dietary glucose or other carbohydrates, the overgrown yeast metabolize these sugars through aerobic fermentation. This process occurs primarily in the small intestine, where yeast has access to undigested carbohydrates. In the presence of excess dietary glucose or other carbohydrates, the overgrown yeast metabolize these sugars through anaerobic fermentation. Ethanol absorption into the bloodstream. The ethanol produced in the gut is absorbed through the intestinal wall into the portal circulation and enters the systemic bloodstream, raising blood alcohol concentration. Clinical manifestations of auto-brewery syndrome: dizziness, disorientation, headache, nausea, fatigue, anxiety, red skin, dehydration, memory loss, slurred speech, motor issues, etc. The diagnosis of auto-brewery syndrome. There is no specific test to diagnose auto-brewery syndrome, but in few cases they are diagnosed accordingly according to medical history, blood alcohol testing, carbohydrate challenge test, gut analysis, and etc. Treatment of auto-brewery syndrome. Antifungal or antimicrobial therapy. Sometimes antibiotics are used if bacterial overgrowth is involved. Treatment should be guided by stool or small intestinal cultures. Dietary modification. Low carbohydrate diet reduces the sugar available for fermentation. Avoid simple sugars, refined carbs, and alcohol. The ketogenic diet has been tried in some cases with success. Monitoring and medical supervision. Blood alcohol level monitoring during diagnosis and treatment. Supervision by a specialist or functional medicine doctor is recommended. Thank you.